I want to thank everyone for joining on this Tuesday afternoon. I know these are crazy and unprecedented times, and you have so many things that you're trying to do right now. So thank you for taking the time out to join us here at CPRO. Before we start today, we want to take a moment of silence to recognize our liaison, our ally, and our friend, Eric Gutschall. So please join me in a moment of silence. Our thoughts and prayers are with him and his family. And now as we begin, today we wanted to really talk about 4 things with you, just to let you know what CPRO and Columbia Pike is doing amongst all of the COVID-19 crazy. Really then the meat of our program today is to let you hear from our speakers who are going to talk about the challenges, opportunities, and resources available for you. We're going to do some Q&A. We want to thank those of you who have already submitted questions online. If you would like, please use the chat function to submit questions as we speak. Each speaker will spend 5 minutes discussing their perspective, and then we'll open it up. If we have time, we will unmute you and do a round robin. It'll just depend how many questions we have up front. So we really appreciate your patience and your flexibility today. Just real quick, it has been an interesting 5 weeks here on the Pike and for CPRO. We have been so blessed. We've raised over $40,000 for our Buy a Nurse lunch program. So these lunches are going to Virginia Hospital Center, the Pediatric Center, the Arlington Free Clinic, Mary Marshall Assisted Living. The list goes on. Look for the orange banners on the Pike. These are free banners to our businesses who are open. Please frequent these businesses. We are also helping our partners like Phoenix Bikes with printing of their fundraising letters and other things. And if you just see a great picture, just hashtag Joy to the Pike. We're just trying to bring joy in these crazy and unprecedented times. So now it is my distinct pleasure to introduce our speakers at a high level today, and then I'll let each one of them go. We have Charlie Meng, who's the Executive Director and CEO of the Arlington Food Assistance Center, better known as AFAC. We have Abby Raphael, who is a former school board member and chair, and she is now leading up the Cooperative for a Hunger-Free Arlington. We're also joined by Lisa Fikes, who is the Executive Director at Volunteer Arlington, and Evan Burfield, who is the lead of Arlington Community Corps. Noah Simon, who is the District Director from Congressman Beyer's office, and then Patrick Hope, who is our state delegate representing the 47th District, which includes the west end of Columbia Pike. So we have a wonderful group of folks here today to tell you about their challenges, their opportunities, how you can get engaged, and resources. So please give them your attention and start bringing in your questions via chat. And we hope this can be a really productive experience. We're also recording this, so it will go out on social media. It will also go out on our newsletter. And if we find that it makes sense to do more, we will. So without further ado, has Charlie joined us?
Yes, here.
Wonderful. Thanks for joining us, Charlie. The floor is yours, sir.
Well, thank you for having me. Let me talk a little bit about AFAC. You know, in normal times, we're serving about 2,000 families in need every single week. At any one time, and I'm going to give you some really general numbers right now. In normal times, we have about 4,000 active referrals. That means 4,000 families could come to AFAC if they chose to. In normal times, about 3,000 of those referred families actually do come to us at some time during the month. Maybe it's once, maybe it's twice a month, but at some time about 3,000 families come to us seeking food assistance. On an average basis, we're serving about 2,000, 2,100 families every single week. Since the coronavirus has come to our community, the number of referrals to us has jumped to close to 4,500 referrals. I don't know yet what the weekly averages are, but we're seeing upwards of 250 families every single day. So there has been a significant increase. So what we're seeing is essentially more referrals to us, more families coming to us who have referrals, and more families coming more often to us. As this continues, I expect to see significant numbers coming to us. Now, we live here at AFAC off of really three things, and we do live in a very generous community. So as soon as when the virus really got to Arlington, we saw a significant drop in the amount of groceries that were being donated to us by the stores. Normally, we get about 110,000 pounds a month. That dropped to almost zero. It has since come back. Very thankfully, though, individual food donations have also increased to about 90,000 pounds last month. So there is some return of that donated food coming to us. The second thing we rely on is volunteer help. So we normally have a lot of older volunteers working for us, particularly during the daytime. Those volunteers, many of them have gone. And I've told them, hey, this is no place for you, get lost. For the duration, you'll be welcome back when all of this is open, but it's just too dangerous for you. A number of them have frankly looked at me and said, hey, Charlie, we're staying, so too bad. And we love them anyhow. But on the other side, we've had a significant increase in the number of volunteers coming to us and asking if they can help. I think in the last 10 days, we have had 551 volunteers sign up with us. So that's a really great help. The third thing we live on is financial donations. And that is very important because very simply, we can buy probably 2.5 times the food that you can in a grocery store because we buy our food from wholesale distributors at wholesale prices with significant volume discounts. So in a lot of ways, AFAC is right now doing very well, but we have a lot more to do. And as you can see from the photographs on the below, we normally provide choice. That is, our families can choose the foods that they want and they will use. That tremendously reduces waste. But unfortunately, with the virus and with social distancing, we can no longer do that. So we've gone to a bagged situation where every family will get a bag of dry goods, a bag of fresh fruit and vegetables, and then a bag of refrigerated items, eggs, milk, a choice of chicken, fish, and hot dogs, and a number of other items. So they're still getting a very good selection of healthy, nutritious foods, but in a bagged situation, that means that they can pick up groceries here very quickly with a minimal amount of transaction time. If you've been down to AFAC lately, you'll notice that we've painted lines on the stairs and on the sidewalks to make sure that all of our families socially distance, and we are requiring that all families coming to us wear face masks and proper protective gear. We've also have 17 other distribution sites around the county. A number of those sites are in the senior living facilities. They're still operating. A number of them are at partner agencies. some of which have had cases of the coronavirus. And in those cases, we are bringing food to those locations, and then staff at those locations are distributing the food out to their families.
So Charlie, it's amazing all the work you're doing and how you guys have stepped up in such a short period of time. If people do want to be engaged, is the best place to go to your website to donate or to volunteer?
Well, our website is www.afac.org, afac.org, and it's clear on the website. If you want to volunteer, there is a section for that. If you want to donate food, there's another section. And there's a section for families in need, and it gives them all of the instructions for how they go about getting a referral to AFAC.
That's
We are
wonderful.
still requiring a referral, but that is a simple telephone conversation with the folks at the Department of Human Services and their 1300 number.
So I do ask you, we're going to move on to our next speakers, but if you do have questions for Charlie, please put them in the chat window. You can do that by going to the bottom of your screen and hovering and clicking on chat. And so thank you so much, Charlie. Next, I'm going to open up the line for Abby Raphael, who was one of the leads for the Cooperative for a Hunger-Free Arlington. Abby, the floor is yours.
Thank you, Kim. So about a week ago, the superintendent and county manager announced the Cooperative for a Hunger-Free Arlington. And I'm happy to be working with Diane Kresh from the library and Amy McCloskey, who's the director of food services at APS, who I've known for many, many years back in my school board days. Excuse me, I'm also losing my voice because I spend most of my time on the phone now. So our mission is to work across Arlington County, the schools, county government, PTAs, the faith community, the business community, nonprofits, everybody, to make sure that everyone in Arlington has the food that they need during this crisis. And we have a particular focus on those who are homebound as a result of COVID for whatever reason, and low-income folks. We're trying to stay focused on equity, and so we have 4 questions that guide our work. That is, who benefits, who's burdened, who's missing, and how do you know? And I have to say, it has been really heartening to see all of the work that's going on across Arlington. When we started our work, we did a quick needs assessment and scan of what was already going on. And there is so much work going on to help feed people in Arlington. So what we're trying to do is look at what's working, what can we support and expand that's already working, and what are new models that we need to add to meet the really unprecedented need that we're going to see, and this new problem of folks who are homebound and can't leave. So AFAC, you've heard from Charlie, that's the focal point of what's going on in Arlington, and I just can't say enough about Charlie's effort and everything that AFAC is doing. Another huge piece of it, of course, is APS. So APS has expanded to 7 different sites where they have grab-and-go meals every day, and that's key. One thing that we've just started to do today, I think, were flyers going out in the grocery bags that folks are picking up at the APS sites, telling them about AFAC and dispelling some of the fears that people might have about going to AFAC and, you know, is this going to get them on some government list or something like that. So we're hoping to get more families to AFAC that way. One particular area of concern are low-income senior citizens who are more vulnerable and can't be leaving their homes. So we were very pleased to get a $75,000 grant last week from the Community Foundation to provide meals that will be delivered to folks in their homes, lunches for the next 10 weeks, and that'll serve 215 of our low-income senior citizens. A lot of what I do is reach out to different funders, national nonprofits, trying to get more money so that we can expand programs like that. Charlie mentioned the 228-1300 number at DHS. We are adding more staffing to that so that folks can call that number if they don't already have a resource from AFAC or Meals on Wheels, some form of assistance and they're not able to get out of their homes, they can call that number and we will match the right resource to those individuals to get groceries or meals delivered to them in their homes. You're going to hear from Lisa with Volunteer Arlington, which none of this would work without. It's just remarkable the opportunities that they are showing there and the volunteers they're providing. In addition, we've got PTAs, the faith community, who have pantries. We have restaurants that are stepping up. Many of them, for example, Bayou Bakery is producing about 400 meals a day and providing those to low-income families at a variety of elementary schools. The Arlington Y is providing produce. There's Food Rescue, which is another group that takes food that is unused from restaurants or businesses and gets those to those in need. So a lot of what we're doing is finding a resource and then matching it where there's a need. We're trying to look at what we could do maybe with food trucks and more with farmers markets. So we're always looking at new opportunities. In terms of challenges, really knowing what the needs are, and I mentioned the 4 questions with equity. Who's missing? That's kind of what keeps me up at night. Who do we not know about who needs help? One thing I keep hearing is fear that people have to go to an APS feeding site, or fear that they have to go to AFAC because they're afraid of getting sick, or they're afraid of, again, like ICE coming to get them and getting on some list. So really getting the messaging out that it is safe to access the resources that we have. There's social distancing in place. You can go to APS, they don't ask for any identification at all. For AFAC, it's simply an ID and proof of residence. They don't share information with anybody else. We have resources, we have more resources that are available right now that folks aren't accessing, and we want to make sure that they know it's safe to do that. And then planning for future needs, trying to get more information, looking at census tract data, looking at unemployment data, so that we know what the scope of this problem is going to be, and we can be planning for the future to make sure that we can meet the needs as they continue to grow.
Oh, that's great, Abby, and thank you so much for stepping into that role. This is no easy task. I mean, solving Arlington hunger along with your partnerships with Charlie. And now next up is Lisa Fikes, who is the Executive Director of Volunteer Arlington. Lisa, the floor is yours.
Thank you, Kim, and thank you, CPRO, for organizing this meeting today. I really appreciate your efforts in this. And kudos on the Buy a Nurse a Lunch program. That's amazing and super exciting. Just to give you a quick overview of Volunteer Arlington, you might or might not know, but Volunteer Arlington is a public-private partnership between Leadership Center and Arlington County. And our role has always been to connect individuals, groups, and businesses with volunteer opportunities. Specifically in this emergency, we are part of the emergency support functions with the Emergency Operations Center, working on a daily basis with Department of Human Services and Emergency Management as it relates to volunteers and donations. So that's our small piece of the puzzle in this, but that's the role we're playing at this specific time. When you all asked us to name the challenges, they're numerous for all of us, right? But I think as far as it relates to volunteerism, I heard one of our nonprofit partners speak yesterday, and she said, you know what, the way we engage volunteers has completely changed in the last month. And I've known that and I've seen that, but hearing her name that and seeing the frustration of wanting to engage people but wanting to do it safely and then being worried about putting them on the front line, is certainly a concern. I so much appreciate what Charlie said and the position he was in and his leadership and guidance in this arena. But I do think that's one of the challenges. So many people want to engage, and how do you do so safely, and what are the ways that you can be of support? The way we're organizing it on our Volunteer Arlington page, and you can see on the right-hand slide, if you click on that opening slide to the COVID Care for Community page, we're working with our various nonprofit and county partners who are on the front lines. And there are 4 big buckets that our nonprofits are needing. The first and best way that you can connect, or anybody that you know can connect, as Charlie mentioned, are those monetary donations directly to the nonprofits. They can do so much with those cash donations. I know it's not glamorous or sexy always to see that, but it is a huge need. And so we want to be a voice for that. And so if there's a cause that's particularly important to your heart, well, I would encourage you to give those dollars to those nonprofits that are working around the clock on those essential services. The second bucket and way that people can connect are through supply donations. Those are a variety of different things, whether it's the PPE, masks, gloves, toilet paper has been a huge need, and all of those needs are listed on that COVID Care for Community page. They're also starting to get creative around some of those supply donations, and I'll give an example to Bridges to Independence. Many of their families are stuck inside of their apartments right now. And so they've come up with a way that people can work together and come up with anti-boredom kits so that they can share those with the families. And they've got specific instructions of how people can put those kits together and really make a difference for those families who are at home and juggling taking care of their kids during this time. All of those, again, are listed on that COVID-19 Care for Community page. The third way are through the physical volunteers, and there are still needs for that. We still do need people getting food to the people that need it, and that's really the biggest need for physical volunteers right now. Obviously, start with AFAC, and we've got the link on that page to the AFAC page, and they've got a great team that are coordinating and getting those volunteers connected. There are some other physical volunteer needs that come up with the affordable housing communities in particular. And when those come up, they go on the page. We also do social media alerts around that, around food distribution. And back to Abby's point, many of the PTAs are doing an amazing job with food distribution, and they are starting to use our site as well when they need volunteers. I was just speaking with Randolph earlier today on a call, and they've got a food pantry that they've been running for the kids that are there in their population on free and reduced lunch on a regular basis. And so they post those volunteer needs when they have them. And then last but not least is the changing face of volunteerism. We've always known that those moments of volunteerism, what we sometimes call micro-volunteering or virtual volunteering, was part of the equation. That for specific role is really ramping up during this time. And there are some virtual volunteer roles that are really important to the mission of our organizations. So if that is something that you're interested in participating in, those are being listed as they come up as well. Some examples of that: Aspire After School Learning is looking to train some volunteers to help with tutoring. So if you're interested, you can find that link there. Also, Arlington Free Clinic is looking for translators when they're working with their various clients and their appointments, and that need is on there. So see that page always evolving, but those 4 buckets are some of the ways that you can be of support. We also launched a new program, realizing that there was such generosity in the community wanting to give and needing some ways to channel that. Also seeing the needs that are already there with food insecurity and rising by the day. We launched the Buy a Neighbor lunch program that's on our website. We're in the pilot phase right now. In the first week, we've raised over, sorry, are we okay on time?
You're good.
Okay. We've raised over $22,000 in the first week from $10, $20, $30 donations. And we are working with one restaurant right now, Bonchon, who is creating the meals, paying their workers to get those delivered to Doorways to Bridges, to one AHC property, and to some neighbors in the Bonder Johnson community as well. And that program is expanding in the next week. So if you're interested in being a part of that, we encourage you to take a look at that page and being in touch with us. And last but not least, serving as an advocate for volunteerism and civic engagement is huge. In any way that you can share this hub of information on the COVID Care for Community page, that is a huge way to volunteer and to serve. Also, being in touch with your neighbors, with those that are immediately in your sphere of influence, and taking care of those folks. And I know that our next speaker will speak to that, but through the community core, that's a great way for you to take care of those right in your sphere of influence. And to be of help to them. So I would encourage you to do that as well. If you haven't followed us on social media, I encourage you to do that, Volunteer Arlington. And if you're interested in being added to our newsletter that goes out on a weekly basis, feel free to email us at volarl@leadercenter.org.
No, thank you so much, Lisa. And I will tell you, for everyone who's attending today, we will make sure we get out all the links as well as the webpage. And you can go to columbiapike.org and ask us any questions. We do have questions and comments that are building up in the chat screen, and we are taking a look at them. So I would ask our speakers, as they're not speaking, to take a look and see which ones you're willing to address. And next up, we have Evan Burfield, who is the leader of the Arlington Community Corps. Evan, the floor is yours.
Thank you so much, Kim. Yeah, as you identified, the Arlington Community Corps is a new volunteer-led organization that's really kind of come together around the COVID crisis. And our focus really is creating a network of captains and volunteers at the neighborhood and block level across Arlington that can step up and provide sort of direct support both to people in need and to put buddies in place so that people have a sort of connection point should needs arise in the future. A really important message that we're trying to drive right now is the idea of sort of emergency preparedness, and that while the county needs a countywide plan to sort of get through this, it's incumbent on each resident within Arlington to sort of put together their own personal emergency preparedness plan and to make sure that they have a connection point outside of their immediate family or social circle who can step in and support if they get sick or they have economic needs that are real. An example of a call that came in to our hotline yesterday was an Arlington Public School social worker. She had a client, didn't speak English, Nepalese speaking, was a single parent, no car, and a child with special needs. And she lived too far to be able to walk to a food distribution center and get back while leaving her son at home alone. And so we put in place, we assigned a buddy through one of our neighborhood networks who is coordinating to make sure that we can actually get food delivered each day to sort of support. Those are a lot of the kinds of needs that we're looking to engage. Right now, we're seeing a lot of the needs sort of concentrated in some of the more economically vulnerable populations. We have not yet seen a lot of direct health-related needs. A lot of it is more displacement given the current economic crisis that we're trying to respond to. Tremendous thanks. We are a completely volunteer-led organization, and whether it's a lot of the leaders like Abby Raphael or Libby Garvey, John Weistad, Christian Dorsey that have kind of come together to help us get the word out across Arlington, or whether it's a lot of the people that are helping to organize the group or their local neighborhoods like Adam Henderson from Douglas Park, who's just done tremendous work in his backyard and across Arlington. We certainly need help. We have about 350 volunteers right now, which has been tremendous to sort of see the response from across the community, but we still only have about half the community covered. A lot of the focus for us right now is in sort of filling in captains and volunteer networks in some of those neighborhoods we don't have as much coverage in yet, as well as really engaging in active outreach and getting the word out to some of the communities in Arlington where we are already seeing need and where we expect to see a lot more needs. So we're doing everything from getting, signs up in the median to just let people know about, the hotline they can reach out to if they do have needs that pop up, to sort of very directed outreach into some of the non-English speaking communities to find people who can help with language skills and help with sort of trusted outreach per some of the questions earlier.
No, thank you so much, Evan. We really appreciate the work you're doing. And it sounds like you are engaging directly with the civic associations and with CERT and with all of those who have already spoke today on the call. So you've been a little busy.
Yeah, it is. Obviously it's coordinating with groups like Abby's and Charlie's on the food side of things, and then outreach with PTAs, civic associations, a variety of different groups to try to get the word out to people about the need for personal emergency preparedness plan and how we can help to get you someone who can support you outside of that immediate family or social circle.
And we really thank you for stepping up and doing this in this time of craziness. So really appreciate it.
Thank you.
Next, we're going to pivot a little bit, and we're going to talk more at the federal level, what is happening in Congress, how we are looking to actually support our neighborhoods and our community at a higher level. So next, I'm going to turn it over to Noah Simon, who is the district director for Don Beyer's office. Oh, hold on one sec. I'm opening too many tabs. Oh, geez. And Noah, the floor is yours.
Thanks, Kim. Well, that's not my picture, but it looks good. The hair looks a lot better. So thanks, everyone. Particularly thanks to my colleagues who are on the call who are volunteers. I get paid to do this, and many of you don't. So really commend Arlington coming together, as we always do, to help people in need. I'll start with the challenges first. We were asked to talk about challenges. I work for Congress, so I suppose that is a challenge, although the person I work for is not the challenge. The federal government is trying to function here, and I think what I want to go through real briefly is hot off the presses. The leadership and the White House just came to an agreement on what's going to be in the next package, and I know that's important to a lot of people. Before I jump into that, I did want to mention tomorrow there's a teletown hall at 4:50 p.m. That Congressman Beyer is hosting. We will have somebody from the U.S. Census Bureau, we'll have somebody from Governor Northam's office, and we'll have a representative from the Small Business Administration. We do not want to be that person. So those typically go for an hour. Just go on to beyer.house.gov and you can register for that, and you'll get a call and you just pick your phone up, and it's as easy as that. We've done, we do about 70 constituent calls a day, just unemployment insurance, where is the PPP program? Today's issue was how can the president stop immigration? We're not sure that that's actually legal. Congressman Beyer does a weekly call with the governor, and then on Fridays he does a call for all members of Congress with the White House. And those are both actually very informative. The calls for the members of Congress are a bit different than the daily press conferences that you all see. Let me jump right into this, and I know that time is short, Kim, so I will go quickly through it. What the package is going to be voted on in the Senate tomorrow, and then by the House on Thursday. Unfortunately, Thomas Massey of Kentucky is going to make the House members come back to vote in person rather than by unanimous consent, which is disappointing, but it is what it is. For small businesses, the Paycheck Protection Program is going to be funded at $310 billion, with an additional $30 billion. So $30 billion of that's going to be reserved for community-based lenders, small banks, and credit unions, and $30 billion for mid-sized banks. We know that a lot of the banks around here got squeezed out of the first round because it was the big banks that got to it first. The small business support beyond PPP has $50 billion for SBA emergency disaster lending. So those are the bridge loans basically, and $10 billion in SBA emergency disaster grants. For hospital systems and healthcare, it says Democrats, but sorry, you can tell what talking points I'm reading off of. Congress secured $75 billion to provide resources for personal protective equipment. And thankfully, the administration's agreed to improvements of the CARES Act that was passed a couple of weeks ago, which includes lowering the interest rate on advance payments and lengthening the repayment schedule on some loans. And then for all Americans, there's going to be $25 billion for testing. And the administration, it appears, has agreed to a national strategic testing policy. Well, that's a little late. So those are the pieces that, that's what our office has been dealing with. The implementation of what Congress does has been a bit bumpy. We're also dealing with many of our constituents have not received their $1,200 stimulus check, those who are entitled to it. It was held up for a couple of different reasons, and we are hammering away at the IRS. There is an IRS site if folks do want to know. Just go into irs.gov. Sometimes it works, sometimes it doesn't, about the status of your payments. And then the last piece is the unemployment insurance. While it's a state issue, obviously, we're not going to run away from it just because it's at the state level, and I'm sure Patrick will talk about this. But we are in close contact with the governor's office about that. He has staffed up that call center a lot more, replaced the servers, so we trust that will be going on a little bit smoother.
No, we really appreciate you joining us today. I know you guys are busy. It's great to hear that some of the pieces are coming together and we're moving forward as a community and as a nation. So thank you for all of your efforts, and please thank the Congressman as well on our behalf.
I will. Thanks, Kim.
And next, kind of pivoting one more time, we have Patrick Hope, who's the delegate of the 47th District, joining us to talk a little bit about how the federal perspective now goes down to the state perspective. And Patrick, the floor is yours.
Hi, Kim, and everyone. Thank you so much for having me. We do have some challenges ahead of us at the state level. The most glaring one, of course, is our budget. Our budget is going to take a really big hit. And of course, all of that does trickle down to the localities as well. We don't have an accurate account of a forecast of what the hit is. We do know that as of last week, over 400,000 people have applied for unemployment claims. And of course, we're processing those claims as quickly as we possibly can. Well over half of those individuals that have put forth an unemployment claim are receiving benefits or receiving funding as we speak. But then, of course, we're helping direct people with the CARES money to getting their small business loans as well too. But the budget we anticipate is going to be at least $1 billion hit. You've probably seen reports from the governor that he has in looking at our budget, which was probably one of the best budgets that I've ever been part of. This was my 11th session, and just a progressive budget of things where we increased the minimum wage. We put a tremendous amount of money into affordable housing, $60 million a year. All of that is put on pause because we just need to get a better handle of our forecast of what our cuts are likely to be. I think if there is any silver lining when we're compared to other states, we do have the backstop of the federal government, where we do have a lot of people that are employed by the feds. We have a lot of big businesses here, especially in Northern Virginia, that people are able to work from home, but there are quite a few people who aren't able to work from home and who are unemployed. And we've got to help those individuals get back on their feet. We got to help the businesses as well too. So I would say from a high level perspective, the budget is our top concern. We go back tomorrow for a reconvened session. I would say that the second big challenge that I think we're facing and every state's facing is, when do we reopen? As you know, that we are under Executive Order number 53, which is extended through May the 8th, which is a Friday. And as you all know, that bans any crowds of 10 or more people. It closes recreation and entertainment like gyms and theaters. It limits and restricts us just to restaurants to just takeout and delivery. And so the question is when are we going to start easing some of that? Of course, as everyone knows, the bottom line is that people are instructed to stay at home unless they can get out for essential services. So that is the challenge that I know the governor, as you know, has meetings with the press Monday, Wednesday, and Friday. We have meetings with the governor on Tuesdays and Thursdays. And of course, we get frequent updates from staff of how things are going. I do think that when you look at opportunities, when we go back for reconvene, that's going to be some things where we're looking at shifting a few things, and there's a provision in the governor's budget where we would extend what they call gray machines, which should bring in an additional $150 million. That budget amendment is going to be devoted specifically to COVID care, a fund, and we're going to direct that to where there is the most need. We will have to come back for a special session because the reconvene session is only a place where you can consider governor's vetoes and amendments. You can't consider new legislation. And so we will have to set a special session when it's safe to do so. It's gotten to the point now, and I know Congress is doing this as well, where we're trying to figure out how we can vote remotely. And so we literally have to go tomorrow to change the rules in order to allow us to figure out a way in the future to vote remotely. But there will likely be a special session. And the opportunity there is to take a look at what our budget currently is and how we can reprioritize it. It's going to be painful for sure. There's going to be cuts, but to redirect those funding cuts to where it's needed the most for people that are really suffering, people that are looking for housing, people that are looking for employment, and helping those small businesses get back on their feet. That has to be our number one priority. There are a number of resources that the governor has already directed. Just to criticize the previous speaker, Noah, Congress is able to print money. We're not able to do that. So we can try to redirect some money And we're doing a little bit of that, not to the extent that we wish we could. The governor is directing $70 million for child care for essential workers. He's also set aside a fund, about $2.5 million, not a lot of money, but that tells you how much money we currently have at his discretion. $2.5 million for emergency funding to house the homeless. We're likely to see some more resources come out of this reconvene session that we're going into. But if you're aware of anyone who has any problems with employment or housing or a small business that needs assistance, you can direct them to any of our offices in the delegation. You can direct them to me, and we will get in touch with the right people to make sure that they can pull down the resources that they need. A lot of the other things that are happening in the state, I've heard even from teachers who are seeking to get relicensed, people just going to the DMV as well to get their license renewed or things like that. All of that has been extended, and so there's a grace period, and in some cases it's a year, in other cases it's 60 days or longer to 90 days. As this pandemic continues, there'll be a reassessment of whether to extend these deadlines even further. Tax day, a very important tax day that's coming up. The tax filing for the state level has been extended until May for filing, but you can't get out of paying your taxes. And so we've extended that until June, but you do have to file in May. And the reason why that is, and a lot of people have complained about that policy and why they don't do it a little bit longer, and that is because our fiscal year expires at the end of June. And so we've been told by the administration that they can't move that date for paying your taxes any later until that June date. So let me go ahead and stop there, and I'm happy to answer any questions. But again, Kim, thank you for the opportunity to be here this afternoon.
No, absolutely. And everyone who's joined today, thank you so incredibly much to our speakers. I know you guys are busy. You're doing a lot of things, and I'm just amazed how the community as a whole is pulling together and really getting us through these times. So thank you. So next we have Q&A. There's been a lot of questions that have been lining up now, and we received some before the call today. And I think we have 7 teed up. And Amanda, can you read the first question for us?
Certainly. Our first question is about how Fairfax County actually is delivering meals using school buses and the existing school bus drivers, and have basically since the schools went online. Is there a reason that Arlington Public Schools haven't been able to make that work? They're still doing the physical drop-off and pick-up locations. And what are other best practices that APS and county staff are looking at from around the nation, including our neighbors in Fairfax County?
So I'm wondering if Abby or Charlie or anyone else would like to dive into that question.
Yep, I can take that one. So Loudoun County and Fairfax and a number of jurisdictions around the country have used that school bus model in conjunction with feeding sites at schools. APS started, I think, with 3 sites. They expanded to 5, then they expanded to 7, and they have done a pretty in-depth analysis to look at walk distances to try to ensure that everybody would be able to get to those 7 sites, and looking at where the most need is. It's important to know that anyone with a child from ages 2 to 18 can go to those sites. You don't have to have a child at that particular school. You don't even have to have a child in APS. If you have a child in that age group, regardless of economic need, you can go and get the free grab-and-go lunch and breakfast. Right now, they're not looking at adding school buses. But as time goes on, they certainly are open to seeing what the difference, how the needs are changing and what they might need to do to adapt to that. And again, they're part of this network of all these other resources with AFAC. So as I said, having flyers to connect folks so that they know how to get an AFAC referral. School social workers can provide those referrals. We have PTAs providing food through different pantries, connections with restaurants providing food to some of our schools. So it all fits into the larger network.
No, thank you. That was really helpful, because I know we had discussed art buses before, but it sounds like we have a plan and a network, and it's working well. So thank you. Amanda, what is our next question?
Our next one's definitely for Charlie. It's about AFAC. I know he answered it in the chat, but in case anyone missed it, someone asked if AFAC has the ability to accept prepared food. Charlie, if you'd like to speak to that.
No, we actually don't have a method to accept prepared food. We're just, we are all groceries here. But I'm going to throw this back to Abby because I think she has ways to, if restaurants want to prepare meals, I think there are ways to get those meals to families in need.
Yeah, a couple of things on meals. So as I mentioned, we have Meals on Wheels, and we're expanding that model to get delivery of flash frozen meals once a week so that we can limit contact. So that will be going to the older adults in the affordable housing sites, and also through that 1,300 number. If people need meals, we will be able to meet those needs that way. And then a number of restaurants. I mentioned Bayou Bakery. I'm in contact with Jose Andres World Central Kitchen to try and expand so that we can get more partnerships with restaurants preparing meals and connecting those to populations in need. So we're always looking for more opportunities so that we can help our restaurants and our restaurant workers and get meals to folks.
Well, that's wonderful to hear. That's just great. Amanda, what other questions do we have?
Our next one's for AFAC as well. Why do people still need a referral to get meals from AFAC, and how do they go about getting one?
Well, they need a referral allows them to be served now for 6 months. That will allow them to be served once a week for 6 months. The referral process really assures us that the family is in need, number one, is an Arlington resident, and then with that referral, we then can track our inventory, which is very important because we purchase in the past, we purchased up to 60% of our foods ourselves. Now that has that's growing in percentage. And it also requires them to go to one of our partner agencies that can assess all of a family's needs. And if they're eligible for other programs like SNAP, a Supplemental Nutrition Assistance Program, TANF, WIC, and other programs, DHS in particular can sign them up for those programs also. So it really gets a family into the social safety net system. And then out of that, as I said, we get our inventory numbers so that we know what to buy, and we can also report back to the county and to our donors about how many families we have served over time. So it's a really important process. I might also go on to mention that the and a government agency would have a hard time getting into that. And we do not keep immigrant status in that database. We don't care if you're an immigrant. We don't really care about your status. If you're in need in Arlington, we're here to serve you.
That's great. Thank you, Charlie. So we just have a few more minutes left, so we may not get to all the questions, but what I'm seeing on the chat is people are actually connecting each other and answering each other's questions, which I absolutely love. We can also help with that process if folks miss it. I do think there was a question about partnering with CERT. Amanda, would you mind reading that question?
Absolutely. How is the Arlington Community Corps leveraging the work and lists of the Arlington Network for Community Readiness and the Disaster Volunteer Registry and the CERT? The latter has neighborhood-based teams already established. Evan, if you want to talk about how the Community Corps is working with that, and Lisa as well.
I'm not personally familiar with CERT, but would love to kind of follow up offline and dig in and see if there's opportunities to sort of collaborate and work more closely with them.
I'm happy to speak to it. Can you hear me, Kim?
Yes.
Okay. CERT are people who have been trained volunteers, and that's run through the county's Office of Emergency Management. So when you've got an emergency such as this, you've got trained volunteers, and that's CERT, and then you've got what we call spontaneous volunteers. that are being run through Evan's work and through Volunteer Arlington. So those trained volunteers are working with Samantha Brand, and if you've got any questions, I'd be happy to get you in touch with her. She's the manager for that particular program. And I know that she always has that lens when different needs come up on our daily calls, and she said that's something that CERT can do. That's the extent of what I know, but I do know that I can connect you with Samantha if you have further questions.
No, thank you, Lisa. CERT is a great program, so definitely take advantage of them and leverage them. I think we might have time for one more question.
We do have one more that's important that hasn't really been addressed. One person did want to know if there were special programs and how exactly mental health needs of our most vulnerable are being met.
Yeah, Lisa.
Sure. I know that that came up with one of our affordable housing units this past week, and that was one of the specified needs. We're working with DHS again on a daily basis, and Kurt Lyric there at DHS had a document that he prepared for that specific nonprofit organization. So if you've got specific concerns, I would encourage you to connect with DHS. And if you'd like to reach out to me and I can get you connected with people, I'd be happy to do that as well.
Excellent. I do apologize, we don't have time for more questions at this time. But what I will say is we've gotten a few suggestions that we need to do this again. So we will definitely consider that. There's also going to be a business listening session like this, but for businesses on Friday at 10 a.m. We'll make sure you receive that information. It'll also go out in our newsletter on Thursday and all of our social media. To stay connected with us, if you look up on your screen, you can follow us in many, many different places. All the information is the same with a different slant. And again, if you have any feedback for us today, I did receive some of it in the chat and I really appreciate it. This is our first time doing this, and I think it's just amazing how the community has come together. I want to thank our speakers. Thank you, Charlie. Thank you, Abby. Thank you, Lisa, Evan. Thank you, Noah and Patrick. You guys are busy. You're doing a lot of work. You're doing great things for us in the community. So thank you so much, everyone. Thank you for joining. Namaste. Stay 6 feet away. Please be sanitized, safe, and stay connected. And until next time, take care, everyone.